Oregon is one of the states hit hardest by the drug addiction crisis, while also struggling to have adequate access to care.
Today, we're hearing from some of the people who are working to reverse the trend by building more treatment beds, but they say bureaucratic hurdles are getting in the way of progress.
Fox 12 investigative reporter Ezra Kaplan has a story. Good morning, Ezra.
Good morning. You know, Measure 110 was the bill that decriminalized drug possession, and it was supposed to provide funds to help the community make up for decades of underinvestment in addiction treatment. And in the years since, as the law has been rolled back, so too has some of the money. And that's been a challenge, both to those working on building more beds and those who need them most. Fernando Marquez had an early introduction to the world of addiction.
Was introduced to methamphetamines at 15, and from there on, I started using heavily right away.
He tried getting clean about a dozen times, but it never stuck. He says he was never really ready or willing.
What made you want to finally give it a real shot?
Okay, so I have 3 kids of my own, you know, because of the drug use. I spent more time out of my kids' life than I have in.
At the beginning of the year, he came here to the Detox at Recovery Works Northwest and has been sober ever since.
How important was that process of detox for you to get where you are today?
In order to get anywhere in life, you know, I had to get off the drugs to get a different perspective of things.
In Portland, there are 130 detox beds, but that's only about a third of the capacity needed, according to a study commissioned by Governor Tina Kotek and the Oregon Health Authority.
So in that report, it states a dire need for beds across the continuum.
Joe Bazeghi is the director of engagement for Recovery Works Northwest and helped to open up this detox in August of last year. For now, they are the newest beds in town.
This is like a miniature hospital. We have 24/7 nursing staff. We have physicians on call 24/7. There's never a time when a registered nurse or licensed practicing nurse is not on our floors.
Bazeghi says it took $1.1 million of Measure 110 funding to get the doors opened. It's the only detox in the Portland area that was started using funds from the law that decriminalized drug possession back in 2021.
We just used the money for a one-time startup bump. Help us get the property, help us get it staffed, and we're going to support it through Medicaid and insurance billing from there forward. Indefinitely, decades to come. Self-sustaining.
But in June of this year, the Oregon Health Authority Council that oversees the distribution of Measure 110 funds voted to change the rules. Starting in 2025, the funds can no longer be used to purchase property or pay for renovations. That's a problem for groups like Recovery Works Northwest, which has plans to build more housing, but is struggling to find the funding.
Right now, we are waiting for political processes when there's shovel-ready projects that could be operational 1 year from the date of funding.
Now they are working to navigate a complicated web of state, county, city, and nonprofit funding sources to cobble together the needed funds.
If there's frustration that I sense right now, it's in how distributed all of these different funding sources are and lack of clarity on where a project like this can receive support without being pushed 2 years down the line.
Especially when the need is now. With a shortage of detox beds, those looking for help are left waiting in line. That's exactly what happened to Fernando.
Every place that I would call, it seemed like there would be a waiting list. And so it kind of gets to a point to where after you call, you know, so many places and that they can't help you because there's a waiting list, 6-month waiting list or whatever, it just kind of gets to a point to where you're like, why even try and continue to call around to see about getting into a place?
He persisted and now wants to become a recovery mentor to try and help others who are struggling in addiction.
So this is the longest you've had clean before?
Yeah.
How are you feeling?
Oh, I feel great. Besides right now, I think the most clean time I've ever had is 78 days.
And now you got 7 months.
And now I got 7 months and 6 days.
It's a system facing years of bureaucratic delays, trying to provide help to those counting sobriety
in months and days.
One of the things that I've heard from folks on the front lines of this work is that the process for both funding and accountability has turned into a confusing and cumbersome web. They say that navigating that web is taking time and resources away from the real work of getting services to those who need them. Reporting in studio, Ezra Kaplan, Fox 12 Oregon.